Pritesh Ashok Pawar, consultant cardiologist, Yashodhara Super Specialty Hospital. Today we will be discussing about hypertension. So, what is hypertension? When blood pressure is more than 140 by 90 millimeters of mercury, then we label patient as a hypertension. So, it has two readings. 140 is the upper reading, that is called as systole. Systole is when the heart is contracting, and the lower reading is 90, that is diastole, when the heart is relaxing. 1 in every 3 individuals Indian is hypertensive, so it's very common. How to detect hypertension is you have to measure your blood pressure. You have to go to a doctor and you have to measure the blood pressure. Nowadays automated BP machines are available. We can measure blood pressure reading at home also. So it is recommended that after 18 years of life, everyone should get themselves detected for hypertension, and everyone should get themselves screened for hypertension yearly. So every yearly you should measure your blood pressure, and if your blood pressure reading is high, then you should consult your doctor. What are the ill effects of hypertension? Hypertension usually does not cause any symptoms, hence it is called as silent killer. But when the symptoms occur, they are very dangerous. So what symptoms we can get from a hypertension is a target organ damage. We can get stroke, that is paralysis. We can get blindness because of hypertensive retinopathy. We can get heart failure because of hypertension. We can get heart attack because of hypertension. We can get kidney failure, and hypertension can cause peripheral vascular disease. So these are the ill effects of hypertension. And now, who can get hypertension? Who are the individuals who can get hypertension? Number one, who have family history of hypertension. Number two, who are having history of addictions, tobacco, smoking, excessive alcohol intake. Number three is obese individual. Number four, with diabetes, hypertension is more common. And number five, patients of kidney diseases, they are more prone to get hypertension. Now, how to control hypertension is you have to do weight reduction. Obesity is very common, so we have to do weight reduction. How we are going to do weight reduction? By physical activity. So physical activity is 30 minutes daily for at least 5 days a week is a must, so that we can control our blood pressure. Number three is reduction of salt intake. So reduction of salt intake is must in our diet, so that our blood pressure remains controlled. Number four is DASH diet. DASH is dietary approach to stop hypertension, in which it is recommended to have lot of fruits, vegetables, whole grains and low fat dairy foods. Fifth is regular monitoring and properly taking of medications. So regular monitoring is done by home based BP monitoring. You can have your BP machines at home, automated BP machine, and you can take reading twice daily, and you can send the reading to your doctor, so that he will come to know whether your blood pressure is well controlled or not. And whatever medications your doctor has advised, you should continue the medication. Sixth is reduction of stress. So stress is one of the important risk factor which is neglected. So by doing yoga, meditation, we can reduce stress and we can decrease blood pressure. So by doing these all activities, we should control our blood pressure, and we should try to remain healthy throughout our life.